So I'm here with two of my esteemed pediatric colleagues. I have to my right Dr. Perez, who's also a pediatrician specializing in pulmonology, and that's disease of the lungs. He is chief of the Division of Pediatric Pulmonology and Sleep Medicine at the UBMD Pediatrics and Department of Pediatrics at the Jacobs School of Medicine, Biomedical Science, and medical director of the Lung Center at Oishei Children's Hospital, and a clinical associate professor at the Department of Pediatrics at the University of Buffalo. And to my left is Dr. Archer, also a pediatrician colleague, interim chief of general pediatrics and the medical director of the Oishei Children's Hospital Primary Care. So we are here today together speaking to you all as pediatricians. So our medical examiner's office at the Erie County Health Department alerted our department to 6 deaths in the span of 4 weeks from the end of August to the end of September among children ages 3 years and younger. And 3 of these deaths were age 1 year or younger. So each case has a suspected cause of death related to either respiratory illness or unsafe sleeping practices. So this is an unusual number for childhood deaths related to respiratory illness. These are absolutely tragic and heartbreaking, and we want to give parents and caregivers the knowledge to prevent this sort of death from happening at your home. So October is also Safe Sleep Month. And as the weather turns colder, and it will turn colder very soon, we have some safety recommendations later on in this press conference to help people create a safe sleeping space for your infant at home. So prevention starts with every single person who spends time with an infant. Parents, grandparents, babysitters, neighbors, occasional caregivers like older siblings, all need to know the signs of respiratory distress in young children, which can appear very differently than compared to adults, and we all need to be ready to act if we see those signs. So I am going to turn it over now to Dr. Perez just to talk specifically about signs of respiratory distress in young children and to share with us what he's seeing in Oishei Children's Hospital.
Good morning, everybody. Again, thank you, Dr. Bernstein, for the invitation to talk about this very important topic. So something that we need to remember is that kids tend to get sick quite often, especially during the winter season. This is not uncommon. And usually these tend to be like minor colds, nasal congestion, some cough. But these colds can turn badly very quickly, especially in young kids, particularly the ones under 1 year of age, and those that might have a disorder or comorbidities, like kids that are born premature, or they might have an underlying condition. So what is very important is that to understand that parents know their kids their best. So if a parent is worried about how the kid looks like, that is a yellow flag, and that's the reason to visit your pediatrician. There are some signs or symptoms we always recommend parents to look for. These include when the kid probably is nasal flaring, which mainly means that the opening of the nose are moving up when you're trying to take a breath in, and this is a sign of like kind of trying to catch a breath or respiratory distress. The other sign that we look for is when the ribs in between, the skin in between the ribs sunken in is called retractions, or when you see a baby that might be bobbing their head up and down and is using extra muscles to breathe. Also, when kids might have some wheezing on the chest, or they might have some stridor or a grunting nose that is telling you that they are using accessory muscles to breathe, so they're running into trouble. Kids usually want to play and they are active, so you see a kid that is very tired, is not waking up. Maybe you have a little bit of fever, you give them Tylenol, but after the Tylenol they don't recover, they seem to be tired, they are not drinking, they are not wetting diapers. All of those are signs of alarm that will prompt a visit to the pediatrician. So the first line of defense is always your pediatrician. So don't hesitate to take your kid to your primary care physician, pediatrician, or family physician. There are other signs that should prompt an ED visit, so an immediate call to EMS or 911. If you see a kid that's very limp or they have the lips blue, that's a sign that there's not enough oxygen going through the body, and that's a reason to call 911 or get the kid to the emergency room. We've been seeing an uptake of respiratory infections at Oishei Children's Hospital over the last 2 or 3 weeks. This is after the school started. There are several viruses. Right now, the virus that we're seeing most commonly is called rhinovirus, which is kind of like the common cold virus. There's a variety of kids. There are some kids that they just end up in the emergency room, but we also see kids in the intensive care unit or in the hospital that they need significant support or just oxygen. So again, just to summarize, what is very important is that anybody taking care of the kid should know these signs. Sometimes parents leave a kid with a grandparent or with younger children to take care of them, either you're running an errand or going to the grocery store. So just make sure that they are aware of all of these signs and make sure that, again, you contact your pediatrician. Do not hesitate to contact your pediatrician. By looking for the right medical care, a lot of times we can avoid an emergency room visit, or we can avoid an emergency room or hospitalization, in the intensive care unit. And I'm just getting back again to Dr. Archer.
Dr. Perez, thank you, and Dr. Burstein, thank you for the opportunity to address everybody. Good morning, all. October is Safe Sleep Month, and that's something that is on the minds of all pediatricians. We want to make sure that all of our kids are getting a good night's sleep, all our parents are. But we also want to remind people that we want their kids to sleep safely, especially their infants. And every parent and expectant parent should follow, these recommendations that we have. They've come from the American Academy of Pediatrics, are endorsed by almost every pediatrician we run into. And we expect parents to trust their pediatricians. You know your child, but your pediatrician knows the medicine. And between the two of y'all, you'll be able to make important, informed decisions about your child's health. And we keep it simple. We want to just follow the ABCs of safe sleep for children. Keep the kid alone, on their back, in a crib. What does that mean? Sleeping alone means no blankets, no pillows, no toys. It's great to have them, but they don't need to be in the crib with the baby. Wrap them in a wearable blanket like those Halo sleepers and keep the room temperature reasonable. 68 to 70 works out very nicely. On their back to sleep. Always place their infants on their back to sleep. Caregivers and grandparents may not be familiar with this practice. A lot of cultures, this might not be familiar to them.
So infants and children ages 6 months and older are eligible for this season's new flu and new COVID-19 vaccines. So parents of children younger than 24 months should also talk to their pediatrician about RSV protection and if their children are eligible for some type of RSV vaccine. So primary preventions mean preventing exposures to illness in the first place. So any adult and children who spends time with the young infants, especially if they've not yet been immunized, really needs to get up to date with those immunizations, just to reduce their risk of transmission of a virus that could be deadly to a very young child with very, very small airways. So washing hands frequently is another very important infection control strategy that I think we can all do. And then also, so is staying away from infants. If you have any signs of any respiratory illness, even a minor cold, can be caused by a virus that could be deadly in a very young child. So if that can't be avoided, there's always masking. So you should consider masking with a well-fitted mask and wearing that consistently and correctly when you're around the very young child. Really isn't worth getting those babies sick. So we want this message to reach as many parents as caregivers as possible. So if you're a parent or a caregiver, and please share this message with other parents and other caregivers. So these recommendations really should be turned into a regular part of your child's care. So with that, I can open it up to any topic-related questions, if there are any.
Could a symptom of shortness of breath in a child be connected to maybe some cardiac issue, like Wolff-Parkinson-White? And would that be something that a parent or caregiver should look out for as well if they see their infant struggling to breathe?
That's a great question. I'm going to turn it over to Dr. Perez, head of pulmonary.
So if a kid has an underlying cardiac disease, they usually are more prone or at higher risk of complications from respiratory infections. These include kids that have shunts in between the chambers of the heart. That also includes kids that might have issues with electrical activity of the heart, as the example that you brought up. But yes, so any parent that knows that their kid has an underlying medical condition, those are the kids that you should be watching more carefully. And then you need to contact your primary care physician, or if you're already under the care of a cardiologist, contact your cardiologist, or you're under the care of a pulmonologist, contact your pulmonologist. There is a population of kids that they might not know that they have a condition, so that's what we would like to reinforce parents looking into for all of the signs that we talk about, like any kid that is limp, blue in the lips, they are not eating, they are not drinking, they're not wearing diapers, or they have signs of respiratory distress, they need to be seen. Don't wait too long. If you wait too long, that is the case when kids often end up in the emergency room, or they might end up in the ICU with respiratory failure.
Thanks. Anything else?
How important is it to have a baby monitor to kind of, as your kid's sleeping, to, I guess, to know if everything's okay?
That is a great question for Dr. Archer.
And that is indeed a great question. I think nothing is more important to parents than peace of mind, and having that baby monitor is never going to be a bad thing to have on hand. I think it's good to give people that sense, not so that I can say, oh, everything's completely fine, but it does give me that sense that I'm preparing this room for this child to be completely safe when they are sleeping. I think it's a good idea to have that monitor. We can have them where it hooks up to your phone, where you can have it at work with you, so you can have an idea of what's going on with your child when they're sleeping. The most important thing you have to do, though, is monitor your monitor. You can't just set it and forget it. You need to pay attention to what's going on with that monitor and not just leave that as the only thing that allows you to be on guard for your child's care and safety. I think they're a good idea, not a problem.